everybody, I'm Shelby, and this is my healthcare finance project titled Neonatal Abstinence Syndrome Center. So many of you guys are probably thinking, what is neonatal abstinence syndrome? Well, it happens when a baby is exposed to opioids and other drugs while in utero. From their very first breath, the baby begins to withdraw. Some of the symptoms that are included when they're withdrawing is jitterness, severe dehydration, convulsion, and the list goes on from there. There is a scoring system that was developed to determine the severity of their cases. Background on the NOS Center. The opioid and heroin epidemic is sweeping across the United States, especially in the Midwest region, which includes us here in Ohio. Infants born addicted to drugs have quadrupled in the last 9 years in the United States. Currently, when these babies are born, they stay in the NICU throughout the entire withdrawing process. Most stay on average for about 3 days, while some NOS infants can stay longer due to complications or other health determining factors. Unfortunately though, physicians don't know the extent of damage the drugs have on the infant until they are born and have been treated by the doctor. NOS infants need specialized care that they do not currently receive in the NICU. The NICU is for intensive care babies born premature, have low birth rates, things of that nature. NOS babies, though, they need a different type of care that is specifically trained doctor and or nurses who oversee the center will be able to provide for them. The market will be determined by using statistics from the current NICU at Akron General Hospital on infants with NOS. The market includes infants who are born from white women, typically between the ages of 18 and 26, who are in middle to lower class and are addicted to drugs throughout their entire pregnancy. There are 84 babies born with NOS disease daily in the state of Ohio, and us here in the Akron area have seen a major increase in drug use. The new NOS unit would be able to see around 16 new patients daily, since patients stay on average 72 hours or 3 days, sometimes even longer, which would result in about 5,840 visitors per year. The proposal for the NOS Center would be listed with these assumptions. There would be a 40-bed unit. It would be open 24 hours a day, 365 days in the year. It would be a unit within a unit, so it would be an expansion of where the current NICU is in the hospital. Proper medical staff, including doctors, nurse practitioners, multiple RNs, a social worker, and a case manager would be within the facility. There would need to be adequate medical supplies and medications that would be provided to the patients in the NOS Center. The average length of stay would be around 3 days or 72 hours, and this is just for the babies who are going through withdrawal. If there are more complications that exist, the stay would be extended possibly a lot longer than that. The average cost is around $3,000 per day per infant. The financials of this proposed unit include both fixed and variable expenses. Fixed expenses do include employee salaries, employee benefits, employee-related trainings, equipment, furniture, office supplies, and marketing. These fixed expenses definitely outweigh the variables. The variable expenses would include medical supplies and medication. Now these will change depending on the occupancy in the unit at that specific time. The medical staff is going to be the highest expense, but it's also the most important expense due to the training and educating on how to care for these NOS babies, especially since this would be a new facility and the first of its kind. Revenues are only generated if the facility is running at 100% occupancy, and even then, revenues are going to be relatively low for this program. They're going to be around $390,000 at this time, which is it is expected because typically maternity and children units do not profit overall for hospitals. But they do, however, make up the highest costs, typically about 25% of the total hospital cost. The payer mix is going to include Medicaid, self-pay, and private insurance. Medicaid is going to cover about 80%, self-pay about 15%, and private insurance 5% or less, if even at all. Majority of the reimbursement will be through Medicare for the NOS unit. Medicare currently covers over $1.5 billion in opioid neonatal treatment. Considering the market that's involved with most of the self-pay, will fault in probably no pay. The break-even point detailed in the 18th month startup shows that at 80% occupancy in month 10, the unit would break even. However, that does not include the variable costs, which would be factored in monthly. The NPV, or the net present value for this proposal, is negative. Although it is negative over $1,105,000, meaning the projected earnings do not exceed the anticipated costs, it doesn't mean that the development of the NOS Center would not benefit the community. The IRR, or an internal rate of return, is going to be less than 1%, suggesting profitability is going to be very low, which we've seen. The operating margin at 100% occupancy is 3.97%, which is how much of each dollar of revenue left over after both the costs and goods sold and operating expenses are considered. With over 84 NOS babies being born daily in Ohio, a unit is needed to provide proper care. Recommendations. The NOS infants tend to fare poorly by most health and socioeconomic measures, but it's not clear whether that's the result of the drugs in their systems at birth or their subsequent upbringing in often terrible homes by parents prone to drug use. By providing a facility for infants who were born dependent on drugs, our society can continue to monitor and track that there are no long-term effects on these children. The unit would be the first of its kind with this specialized care provided. The NOS Center needs to be created to help the most innocent victims of the epidemic, regardless of financials. Funding for the NOS Center will include capital expenses of $500,000. Funding would go towards incubators, medical equipment, computers, computer software, and other furniture. The NOS Center will be an extension of a current unit in the hospital, so no extra costs will occur for building or land. The center is currently in high demand and is highly recommended to care for the most innocent victims in the opioid and heroin epidemic taking over the state.